So we have the program of events, and I need to confirm that we can all see my screen. If you can see my screen, can you just give me a thumbs up so that I know that you can see my screen? Thank you so much. Okay. So, firstly, we're going to be having the opening remarks by the Managing Director of Pinecrest Healthcare Limited, Dr. Chijioke Onya. And this will be followed by the welcome remarks by Mr. Shafiq Shaikji, the Blood Safety Application Specialist, Biorad Laboratories USA. That will be swiftly followed by the welcome remarks and declaration of the webinar open by Mrs. Stella Atewe, who is the Director of the Medical Laboratory Services, Mainland Hospital, Yaba. She's going to be ably represented by her Deputy Director, Mrs. Atunda, today. And then we'll have a goodwill message by Mr. Stanley Obonna. Mr. Stanley Obonna is also going to be reading the citation for our keynote speaker. Afterward, we'll have the keynote presentation on the topic, Diagnostics in the Microbiology Laboratory, Addressing the Pain Points by Dr. Abraham Alabi, who is our keynote speaker. Then this will be followed by the Biorad IDD solutions that address the pain points in diagnostics and the microbiology laboratory presentation by Shafiq. And then lastly, but not the least, on our major programs of events today would be an insightful panel discussion session with Mr. Oluwatosin Ogunwola, Lab Manager BT, Mrs. Favor Ofem, Head of Microbiology Laboratory, SynLab Nigeria Limited, and Mrs. Chiamaka Nze, who is the Head of the Microbiology Laboratory at L Lab Limited. Afterwards, we're going to be having your questions and your answers as well as your comments because I believe that a lot of people would share their experiences and we would all go home learning something new. Then finally, we'll take the closing remarks and the vote of thanks by Pinecrest Healthcare Limited. Without wasting much of our time, I'd like to make welcome the Managing Director of Pinecrest Healthcare Limited, Dr. Chijioke Onya, for his opening remarks. Sir, the floor is yours.
Thank you very much, our dear Eunice. And let me establish the protocols that I think is going to help us in course of this particular program. And I want to start by first of all recognizing and appreciating the special guest of honor, our dear Mrs. Stella Atewe, the Director of Medical Laboratory Services, Mainland Hospital Yaba, who is ably represented by Mrs. Atanda Kafaya Tabalade, the Assistant Director of Medical Laboratory Services, also of the same institution. I also want to recognize and appreciate the presence of our keynote speaker, our dear Dr. Abraham Alabi, who is a technical advisor, Health Focused Diagnostics Nigeria Limited, a thoroughly and a well-grounded professional and somebody who has both the experiential and the didactic knowledge in the area of medical microbiology and the infectious diseases. I also want to sincerely appreciate the presence of our dear Shafiq Shaikji. Shafiq Shaikji is a blood safety application specialist and infectious disease specialist of Biorad Laboratories USA. He's going to be speaking to us all the way from the beautiful city of South Africa. Shafiq, we are sincerely glad to have you in this particular meeting and this particular webinar. Let me also recognize the presence and appreciate the very presence of our other panelists, starting from our dear Mr. Oluwatosin Ogunwola, the lab manager of BT Diagnostics in Ikeja, our dear Mrs. Favor Ofem, the head of microbiology laboratory, SynLab Nigeria Limited, our dear Mrs. Chiamaka Nze, who is the head of microbiology laboratory of LLab Limited. Ladies and gentlemen, Pinecrest Healthcare Limited, as far back as 20 years ago, came up with a vision to provide quality and affordable healthcare solutions, especially in the area of in vitro diagnostics in Nigeria. In furtherance of this particular mission that we set for ourselves, we have implemented, we have also introduced several specialized solutions in the area of in vitro diagnostics. And these solutions are primarily aimed at addressing some of the identified pain points, some of the identified gaps in the area of in vitro diagnostics in Nigeria. I'm so glad that
Very interesting.
our footprints are there for all to see. In the area of HPLC, Pinecrest is clearly the leader. And this is made possible courtesy of the support and the partnership that we've struck with BIRAD, a support and a partnership that is almost getting to the 20 years of age. Also in the area of quality assurance, we are also blazing the trail. As of today, people are beginning to talk about quality and quality-related issues in the area of in vitro diagnostics. All courtesy of this persistent work that Pinecrest in liaison with BIRAD has done in bringing the issue of quality to the front burner. These are some of the things we've done in the past. In the area of electrolyte testing, we're changing the paradigm as we speak with some of the solutions that we've introduced. Just last 2 months, we introduced another solution that is going to change the face of immunohematology in Nigeria. If we introduced and installed the first fully automated walkaway instrument that will help with automated blood grouping and cross-matching and antibody screening and antibody identification in Nigeria. All courtesy of, again, the fantastic collaboration that is going on between Pinecrest and BIRAD Laboratories. Ladies and gentlemen, I'm glad to welcome you again to another epoch-making event today. Because today, Pinecrest Healthcare Limited, again in partnership with our fantastic partners, BIRAD Laboratories, will be launching officially the BIRAD infectious diseases portfolio into the Nigerian market. Some of the products are already here in the market, but there are some that are not here. But today we make bold to say that we are officially now recognized and appointed the representatives of BIRAD infectious disease portfolio in Nigeria. Today's event marks the official introduction and official launch of Pinecrest into this particular space. But beyond just venturing into the area of infectious diseases, I want to make bold that, like we've done in other areas that we have had our footprint, our objective again in entering into the infectious diseases area or infectious disease segment is to bring to the Nigerian market, to bring to the in vitro diagnostic segment, blockbuster products from BIRAD Laboratories that are aimed at addressing a whole lot of the pain points that are associated with the microbiology section of the infectious diseases market. I remember several in the past, people have been asking us what solutions, what platforms you have for infectious diseases. Why are you ignoring or neglecting the microbiology section? Why are you not bringing something that will attend to our pain points? I'm so glad that today, officially, we are entering into this particular space and we're going to be providing the much needed answers, the much needed solutions that will help in addressing these identified pain points. I want to assure you that today is going to be a day that you will not regret. We have arranged an array of well and eminently qualified individuals who are going to be addressing some of the topics that we have lined up for today. The keynote speaker is well grounded, both in terms of experiential and the didactic components of infectious disease management and microbiology testing. He's eminently and ably qualified to handle that topic that's been assigned to him. Also, our um, our specialist, the blood safety application and infectious disease specialist from BIRAD Laboratories USA, our dear Mr. Shafiq Shaikji, has been involved in this particular space for getting close to 15, 20 years. So in terms of experience, he is very grounded and he has worked across several countries in Africa. So he's going to be also sharing with us some of the knowledge that he can bring onto the table with respect to these well-anticipated solutions that will help in addressing some of the pain points in the area of infectious diseases. Our panelists, you can see them, they are shining stars in their spaces. There are people that can stand tall when it comes to in vitro diagnostics in Nigeria, when it comes to pathology. There are people that can stand tall. Am I talking about Tosin? Am I to talk about Favor? Am I to talk about Chiamaka? These are people that have actually put their names on the sands of times. Our dear Stanley is always there with shoulders high across multi dimensions. In the area of quality assurance, in the area of infectious diseases, these are people that have stood the test of time. I want to sincerely welcome all of us to this webinar, and I want to assure you that every second, every minute spent in course of this webinar is going to be very fulfilling. And at the end of the day, you are going to enjoy every aspect of what we've packaged to give you this afternoon. So on that note, I want to welcome you to this seminar and sincerely look forward to a successful outing. Thank you very much as I pass the mic back to our dear compere, Eunice. Thank you very much.
Thank you so much, Dr. Chijioke. I actually caught myself taking some notes during the opening remarks. At this point, I would love to make welcome our very dear Mr. Shafiq Shaikji. He's a blood safety application specialist, Biorad Laboratories USA. Shafiq, if you can hear me, the floor is yours now.
Yes, thank you so much, Eunice, and good afternoon to everybody. I hope everybody can hear me clearly. I'm
Yes.
speaking from very far away. Unfortunately, I have to switch off my camera because it's disturbing the network. So you can have a look at my photo on the invitation that Dr. Chijioke has sent out. So I just like to say I am very, very happy to be invited to this session. Thank you to Dr. Chijioke and the Pinecrest team. Also, just like to reiterate that I was part of the installation and the training on the IH500 automated blood grouping instrument that was installed at Luth. I was very proud to be part of that as well. What a great team we have at Pinecrest. And I'm very happy to say that we are very pleased that we've chosen a partner like Pinecrest to do our business in Nigeria. And then also I'd like to say welcome to all our esteemed guests. Dr. Chijioke did say we're going to have a fantastic afternoon this afternoon. And just to reiterate, it's going to be wonderful. And thank you again for everyone for joining. Thank you, Eunice.
Thank you so much, Shafiq. Thank you for thanking us too. I would like to make welcome Mrs. Stella Atewe, Director of Medical Laboratory Services, Mainland Hospital Yaba, who is ably represented by Mrs. Atonda Kafayat Abolade, the Assistant Director of Medical Laboratory Services, Mainland Hospital Yaba. Ma'am, if you can hear me, the floor is yours. You can unmute and go ahead with the welcome remarks and declaration of the webinar open. Okay, I was told that she's having some difficulties with her network. In order to make progress, I would want to invite Mr. Stanley Ogbonnaya to give the welcome remarks as well as his goodwill message on behalf of Health Focus Nigeria Limited. And then please make welcome the keynote speaker when he's done. Mr. Stanley, please, if you can hear me, over to you.
Good morning, everyone, or good afternoon, everyone. It's a good pleasure to bring goodwill greetings on behalf of Health Focus Diagnostics Nigeria Limited, to our hosts, our dear hosts, Pinecrest Healthcare Limited and Biorad. Thank you. Thank you also, Dr. Chijioke, for this opportunity. And to everyone joining this webinar on the theme, Diagnostics in the Microbiology Laboratory, Addressing the Pain Points. If there's one department in the diagnostic laboratory where the gap between best practices and everyday reality is most keenly felt, it has to be the microbiology department. Anyone who has run a microbiology assay knows the pain points well enough, the long turnaround times that clinicians push back on, the inconsistent quality of specimens arriving at the lab, the cost and availability pressures around culture media and reagents, the challenge of antimicrobial susceptibility testing in the face of rising resistance, and the constant balancing act between manual expertise and the promise of automation. These aren't abstract concerns. They have real consequences. A delayed result, a delayed culture result can mean a patient stays longer on broad spectrum antibiotics than they should. An unreliable susceptibility result can mean a clinician makes the wrong call at a critical moment. In many ways, microbiology is where diagnostic quality meets antimicrobial stewardship and also meets patient safety all at once. That's exactly why a webinar like this matters, naming the pain points honestly, rather than glossing them over. It is the first step towards solving these problems, whether through better analytical processes, smarter workflow designs, investment in automation, or stronger collaboration between laboratory and the clinician. I want to recommend and commend Pinecrest Healthcare and Birad for putting together a session like this and bringing together juggernauts in their various fields to address this matter. To everyone tuning in, lab scientists, microbiologists, quality assurance managers, quality officers, and laboratory directors alike, I encourage you to bring your own experiences into this conversation and to leave with at least one idea you can apply back in your laboratory, because that is what matters. That everything we've deliberated on here goes back and is applied. That is how we make the change that we seek. On behalf of the entire team of Health Focus Diagnostics Nigeria Limited, I wish you a rich and productive session. To the degree that it gives me great honor to introduce the keynote speaker, Dr. Abraham Sunday Alabi. Dr. Abraham Alabi is a microbiologist with more than 35 years' experience in teaching and research into infectious diseases. Over the course of his career, he has worked at various times in reputable academic and research institutions across Nigeria, Bangladesh, Gambia, Gabon, and Liberia, resulting in more than 90 publications in peer-reviewed scientific journals. He currently serves as a technical advisor to Health Focus Diagnostics GmbH, Potsdam, Germany, and Health Focus Diagnostics Nigeria Limited here in Enugu State. Dr. Alabi has supervised and mentored several junior researchers, students at the medical, BSc, MSc, and PhD levels, and postdoctoral students and scientists, many of whom have gone on to become established scientists in their own rights. He currently serves as an external examiner to the University of Venda, South Africa, and is a reviewer for several funding agencies, including the European Commission, the EDCTP, the Africa Research Excellence Fund, and the African Research Network for Neglected Tropical Diseases. Ladies and gentlemen, please join me in welcoming our keynote speaker, Dr. Abraham Sunday Alabi.
Thank you very much, Stanley. Can you hear me, please?
Yes, sir, we can hear you.
Okay, thank you very much. So I'll just share my slide so that we can take off from there. Share, let me see. I was told that sharing is not turned on. Eunice.
Sir, please just check. You should be able to share. All participants can share.
Okay, let me see. Share. Sorry about that. I tried to share, but you say not. Okay, let me see. I think it should be possible now. Can you see my slide?
It's coming up, sir.
Okay, okay.
Yes, sir, we can see your screen right now.
Okay, let me make it a full presentation mode.
Great, sir.
Okay. Okay. So thank you once again. Good morning, good afternoon, and good evening, wherever you are. I must say that really a lot of my colleagues outside Nigeria have decided to join this presentation. So you are welcome. And with the introduction, the first speaker by Dr. Shigioke, and also my colleague Stanley, really this is like preaching to the Pope, because really this has been made easy. So thank you very much for that excellent presentation. As I've been said, actually, I'm both for working as consultant and technical advisor to Focus Diagnostics that is based in Potsdam, Germany, which is a consultancy firm, health consultancy firm specializing in lab strengthening, antimicrobial resistance, epidemic prevention and control. And currently, we have some projects in Nigeria, particularly with the epidemic preparedness and control for West Africa, which is funded by the GIZ of Germany, but we are doing with the whole of ECOWAS countries. And secondly, also, I'm a technical advisor to Focus Diagnostics, Nigeria Limited, based in Enugu. And so for the past 3 years, I would say, I've been coming frequently and I work actively. We have partnered with Unimedical Nigeria Limited to establish this state-of-the-art diagnosis center in Enugu. I'll be talking briefly in that as part of my introduction. So my outline is to start with introduction, and then there's talk about diagnosing microbiology, then emphasize what the pain points are, and then which also is linked to current challenges and barriers in microbiology diagnostics. And then to highlight some best practices that has helped in finding solutions to all these pain points and challenges. And they also highlight some success stories that we have recorded both within and outside Nigeria. And then we'll conclude. That will be the outline for today, for the presentation. So, if we may start from talked about health focused diagnosis Nigeria. This is a collaboration between health focused diagnosis in Germany and Unimedical Nigeria Limited, based in Lagos, and was established in 2024 September. At health focused diagnosis Nigeria, we provide advanced diagnosis for acute and chronic diseases, collaborates with medical institutions to offer specialized tests, and we're also working closely with universities to support the training and the practical experience for students. And we are located at 23B Umunano Street, Independent Layout, Enugu State. And that is also our website. And in summary of what we provide both pathology diagnosis and also radiology diagnosis. So we have laboratory diagnosis, we have imaging, also well-being packages, and also we specialize really on cancer research, early detection, and screening. And for Baurad and also the press club that has invited me to make this presentation, from their website, I've summarized briefly what they do, and truly, as the MD has really informed us, they are really setting the pace in clinical diagnostic instruments and their consumables, laboratory devices and reagents, medical devices, and pharmaceuticals. And truly, they are located in Lagos, Nigeria, and also their website there, so you can follow up more, but really they're in the lead in these kind of categories. So, what are infectious diseases? These are diseases that are, or illnesses that can be spread from person to person, from animals to humans, from human to animals, and vice versa. So, infectious means it can move from one person to another, or from animal to person, or vice versa. And they are caused by microorganisms, which you also otherwise known as germs, such as bacteria, viruses, fungi, and parasites that enter and multiply inside the body. So actually, we are not new to infectious diseases, and they can also be transmitted through insect bites, contaminated food, water, or the environment. And in Nigeria and sub-Saharan Africa, we have diseases such as cholera, TB, tuberculosis, Lassa fever. All these are infectious diseases. Ebola, COVID-19, all those are infectious diseases. Unlike non-infectious diseases that are not easily transmitted and or cannot be transmitted from one person to another. For instance, genetic diseases, chronic diseases like heart conditions, uh, a lot of cancer. These are not infectious, really. So then this leads us to diagnostic microbiology. And this is a science that entails the detection, identification, study of microorganisms. And microorganisms are actually organisms, living organisms that are not visible most of the time to the naked eye. Classified basically as bacteria, viruses, fungi, and parasites. And the role of diagnostic microbiology is to diagnose and manage the infections caused by this disease, by this bacteria or by these microorganisms. And the core methods used in microbiology include microscopy, which is our first instrument. This machine helps us to magnify. So things that you cannot see with your naked eyes, when they are multiplied by 10 times or 100 times, 40 times, you can see. So we're able to see and really feel the bacteria or the whatever is causing the infection. Also, we perform microbial culture, in which case we collect samples from patients and we provide appropriate food for this microorganism to grow. A good example is actually bacteria. So, for instance, you having maybe running stool, we collect your stool sample, or if you have urinary tract infection, we collect your urine samples, and we plate on appropriate media, which could be McConkey, CLD. But what this media represents actually is that we provide this bacteria or this microorganism with the appropriate nutrients that they need and the environment that they need to grow. So you incubate, and within 24 hours, you can see the colonies. And from there, you try to identify. And the first test we do is the microscopy to relate what is the shape, what is it gram-positive or negative, and this will lead us to what we can suspect. So we do microscopy, but microbial culture, and when we have gotten the pure culture growing, we also set up biochemical tests to really identify what are these bacteria we're having at, in lactose fermenter, non-lactose fermenters, and this helps us to identify to species level. This is why you can submit your sample, and they'll say you have from your urine sample the facilitated Escherichia coli or Staph aureus from bloodstream infections and the rest of them. And of course, we also do molecular tests, which is actually more specific, but usually more expensive. And I'm proud to say that from Baurad, we actually have this very sophisticated equipment at our Air Force Diagnostics Nigeria in Enugu. This Baurad CFX 96 well, 96 real-time PCR. This is a real-time PCR that we use for all our molecular analysis, HIV, HBV, HPV, viral load, DNA confirmation. It's really a very versatile equipment. But just at in the introductory part, one of the very pain points or barrier to this is actually the high cost of equipment and tests like this. This small equipment you are looking at there is about, we bought about $100,000 really. So it's not cheap. But from what they can do is worth the investment. So initial cost will be very expensive, but from the services provided and how they're able to diagnose, we use it for HPV. So we screen HPV and we can actually identify the major strains causing the clinical cancer at this time. So in terms of applications, microbiology is used for targeted treatment of infections. So naturally, doctors, clinicians are trained. By their training and experience, they can treat empirically. This means by the time you tell them the history of what you are suffering from, and they do some personal assessment, check temperature, clinical symptoms, presentation, they can treat empirically without going to the lab. But ideally, and the better way is to actually treat by doing a targeted treatment. So once you have given your summary of your clinical symptoms, and after the examination, specimens have to be collected and sent to the lab. And the lab will identify what it is and pinpoint what is causing this infection, and then recommend the best format of treatment. So this is more targeted rather than the guesswork. So we encourage all our clinicians to patronize the lab because this makes things better. If you have targeted treatment, you have quick recovery, so a patient is not on the admission for so long, and then you don't have resistance developing to drugs that are being abused. So really, it's very, very important. And that takes us to also antimicrobial susceptibility testing, which is in the lab. We test microorganisms against antimicrobial substances, which could be it could be tablets or anything, or antiviral components. You test and you know from the result of whether they are resistant or susceptible, you recommend which ones to be used by standard methodology. And of course, microbiology is involved also in infection prevention and control. There is what we call healthcare-associated infections or workspace-associated infections, in which case there are infections that have been transmitted within a workplace, particularly in the healthcare centers. So patients come in with infections, and if care is not taken, no proper hygiene, they can contaminate the environment, and workers or patients on admission can also get this. We call this also sometimes nosocomial infections. And many years back, we did a study in Gabon, in a children's ward in an hospital there, and we found out that within 2 weeks of admission, more than 60% of children that came in actually acquired new infections within the hospital setting. So IPC is very, very important. And of course, we also involved in disease surveillance, in which case, in many countries now, including Nigeria, you have health workers in every part of the country. And when they notice there's an increase in the one type of infection, cholera, for instance, they can report immediately, and then lab team will go there and collect samples and analyze. So in terms of prevention and also bring the disease under control, microbiology plays a very vital role. And to really situate the role of the laboratory in terms of infectious disease diagnosis, from this circle you can see, so the patient there is seeing the doctor, and then the clinician makes a request, samples are collected, transported to the lab, and then the lab analyzes. When you analyze, then you generate information, the types of organisms causing the infection, the susceptibility pattern, and this is sent to the clinician, interpreted and treatment. So this is the circle, and it's really the ideal and make things to work optimally. So you have many high rate of success in terms of treatment of infectious diseases. So the bottom line of this exercise is actually that the gap between what organism is present in the case of clinical infection and what drug will treat it is the single most fixable pain point in microbiology diagnostics. Yeah, so to define briefly, pain points represent a specific problem, frustration, or annoyance that a customer user or business faces. So clinical setup in the hospital or a medical diagnosis facility or a medical equipment supply company, what are the specific problem, frustration, or what are the kind of headache that you face from time to time, and then that you want a solution. And this could be financial, it could be in terms of process, that things are slow, the workflow is not very straightforward, or there is a lot of time wasting in the processes. Financially, it's really on high cost, just as I explained. Also some hidden fees, or very tight, you're operating a very tight budget. We are managing this on almost on a daily basis. You could also have some bad customers service that your company is not providing a very good customer service. And this is actually very important for any establishment, because if you don't treat your clients very well, once they come, that may be the last time. And first, they will not recommend you to anyone, and they will not come around again. But if you treat them well, they come to you for a solution, and you're able to provide in a timely manner. They will be happy to come back, and they will also be your marketer to recommend you to others. And in terms of products, most of in our part of the world, we import most of our products. Happily, a lot of companies are coming out like Pancreas, and they're also really filling the gap. But before now, most of our equipments, reagents, more than 60%, 80% are imported. So sometimes you have poor quality, sometimes some are broken on the way, or we decide to use them, can closed system. So you have some equipment that are closed system. Once your reagent finishes, you can't do anything until you get another one. So in terms of specific pain points or current challenges, barrier microbiology diagnosis in Nigeria and also low and medium income countries, you have in terms of, excuse me, please, I couldn't see my upper slide here. So in terms of equipment, you have a very high purchasing cost. I've just told you what we paid for our real-time PCR machine. Most equipments are in that range, to be candid. And also there's high maintenance and lack of local expertise. I will share some experiences with you on how we have managed this, because really most of this equipment cannot be serviced within the country. So you have to bring the technicians in, and this costs a lot of money. But I also confidently say, in Nigeria today, we have many equipments, providers, suppliers that are really, they have the expertise also to maintain these equipments on ground. There could be issues of supply chain and logistics. You can have supply stockouts, expensive reagents with short expiry dates, cold chain failures. In terms of short expiry dates, is that companies based, like for instance in Nigeria, importing from maybe the US or Europe, this will take some time before the reagents come from, is shipped to you. And then when they arrive in Nigeria, you also have to clear through the ports. While this is going on, the shelf life is already running. So by the time to get to the end users, most of the time, you will have very short expiration dates before they will expire. If you are a high throughput laboratory, then this is fine. But if you are in the medium or low range, this could be a very serious problem. There are problems with cold chains also, from transporting maybe from Lagos to Enugu or from Lagos to Ibadan. If this is not properly done, then the reagents could be denatured or less efficient. And then we have problem with workforce. For instance, really I've worked in a few African countries, and I think Nigeria, we count ourselves lucky that we have adequate manpower to some extent, at least better than many of our neighbors, but we still suffer also from having adequate qualified staff. The salaries are not very comfortable, so poor remuneration people are always moving. There could also be staff shortages and also high rate of attrition. So in Nigeria, we have what we call the Japa syndrome. People just want to go out to Europe or to US and thinking that the greener pasture outside is better. Sometimes it's better, but very often this is not actually the reality. And they may arrive, and then in the absence of finding something relevant to do to their profession, they just take up whatever they can do to survive. But nobody will tell them that is reality until they are there. So really, this is something we need to look at. And I can tell you that wherever you are, to be candid, if you are among the best or you are the best, people will look for your services. This is what I've seen and know from my own personal experience. And of course, we have issues with quality control. So in terms of cost, there are practices that they don't do the optimal. So they just provide the minimal quality control. Some of the time, the reagents also are out of stock, so they don't practice this. And quality assurance, yes, we've talked about it this morning. Very, very important. This is what is giving the confidence to the result you are putting out. And this depends largely on your workforce, how well trained they are, your sample, how you have handled it, and also the quality control internally that you have introduced to the system. If all these are passing, then with your reference ranges and your international control materials, then you are confident that whatever result you are giving out is authentic. Yeah. And in terms of overarching, really, there is really a very high cost of doing business in Nigeria and most of developing countries. So we battle with a lot of things, generate your power, your quality of your water you supply yourselves, high tax, So really, it's challenging. And these are really pain points that we face every day. So, but in the midst of all of this, we are not giving up, and there are best practices that are being implemented and are bringing really very important solutions and productivity in terms of microbiology diagnostic laboratories. So some best practices that we're highlighting here, that in microbiology, you must have a focus on proper specimen collection and analysis, strict contamination control, and you must be using validated testing methods. Also, this is to ensure accurate and timely identification of pathogens and guide effective patient's treatment. Timely there is very important. Turnaround time must be very adequate and accurate, that there's no use that you are isolating a microorganism and also providing the sensitivity testing. And before your result gets to the patient's already gone. So turnaround time, quick one is really recommended. And in terms of also best practices, continue on that line, you have to also be optimal in terms of your collection and transportation of your samples, as we can, all the samples given there. The analytical phase, which is the laboratory processing itself, you must use standardized methods such as the CLSI from the US or the EU CAS for your antimicrobial susceptibility testing. Then we must do a risk assessment and also have biosafety procedures in place. The quality of your media is very essential to having accurate and reliable results. And then you must use reference strains. All this costs money, but it's a worthwhile investment, that you are using reference strains, and this is to assure that whatever result you are getting in your lab in Nigeria, in Gambia, or other places can be comparable to what is done, analysis that is done in USA or Europe, because you are using the standard reference strain that is internationally recognized, and your result is in compliance with what is expected. Your media, your reagents are working very fine. In terms of post-analytical phase of reporting, you must have good reporting system and also stewardship. So rapid communication in terms of important samples such as bloodstream infection. For instance, it's very important that once you have a positive in bloodstream infections, you must inform the clinician that, okay, I have a positive, it's a gram-positive cocci or bacilli, then the doctors can start treatment immediately on your presumptive identification, because it's very vital. Laboratory management information system. This is very important, that you have an efficient system of communicating your results to clinicians, and also that confidentiality is maintained. So, and also that a lot of human error is avoided. So, for instance, in Diagnostics Nigeria Limited, we have a system called a LIMS system by Sava, called Sava, a company in India, and this is accessible from anywhere in the world, but it's very expensive. Initial investment was $100,000 to get this system running, but the versatility of what it can do is worth it. Checking the processing of your samples at any point in time where they are, producing reports at any time you need, your inflow of income, expenditure, all this you can pull up at any time once you are authorized and you are given access. And very beautifully also that even clinicians at their hospital desk or in their clinics, if you grant them access, they can also access the results of their patients. So this is very, very important and good. Then stewardship, diagnostic stewardship, that in all forms and all stages of your diagnostics, there must be stewardship. And stewardship, another term for this is actually accountability, that you are given a responsibility, you are given a role to perform, and at every stage, you are monitored or is guided, that whoever is doing that process knows what to do and is doing what he or she is supposed to do. So there must be proper training, also proper materials that are needed provided, standard SOPs, and which is followed all the time, not some of the time, all the time. And in terms of overarching that you have to do, there must be standard SOPs for all the procedures that you carry out in the lab, particularly the microbiology lab. And there must be quality management system, and every lab that was its name should also aspire to have ISO 15189 certification. And in Diagnostics Nigeria, we are working towards that. And of course, you must be enrolled in proficiency testing, external quality assurance, in which case you enroll with an external body, samples are sent to you, and you analyze and send your result back, which will tell you your performance and also your performance in relation to other laboratories participating in such. In South Africa, they have this. In Nigeria also it's possible. And so this is how to ensure that our results are valid. So I've mentioned this. Parts of best practices is what we can just summarize in this word, stewardship, which means careful and responsible management, protection or control of something entrusted in one's care. So in your field, you must know the onions, and you want to know your onions, know what to do, and be on top of your game in terms of your theoretical knowledge and also experience, and also following your guidelines and SOPs at every time. So there is this tripod stand here, which is looking at a patient with possible infection. It's important we do an antimicrobial stewardship, diagnostic stewardship first, then antimicrobial stewardship next, and then we prevent infection. So there's also stewardship in all these areas of our analysis. So in terms of microbiology, we also mentioned it now, really we discuss about automation and also manual. So we all know that automation in the microbiology lab improves speed, cuts down mistakes, and standardizes sample analysis. So manual methods remain essential due to lower upfront cost, high specimen variety, and the need for skilled critical thinking. So this is one of the pain points in microbiology and diagnosis, that which option to use, automation or manual. And generally, on an average, automation is better, but it's much more expensive than manual. So it's a balancing game. But if you automate your system, then there is less error because human interaction is limited. It also increases speed. And I can give you a clear example. For instance, blood culture. You can do blood culture by manual, and also you can do it by automation. And if you are doing blood culture by manual, normally this will take, before you can conveniently say a sample is negative, may need to take like 5 days. But we have systems that are automated that when you incubate, I will show you some of that. When you incubate, within 2 hours, you can have a presumptive positive, and you can from there do the gramming and know what is causing the infection, set up your antimicrobial susceptibility testing. So within 24 hours, you could get your result ready. Whereas manually, this could take 2 or 3 days, by which time it could be too late for the patients. But the major problem and the major headache and pain point is the cost per test, really. So now we are talking of some success stories here, and I'd like to start first with this microbiology laboratory at the Health Focus Diagnostics Nigeria lab center in Enugu, Nigeria. And like I was explaining, this is an automated blood culture system on my left called BAT-TALAT. It's by Biomerox. So this equipment is optimized to really allow your detection of any bacterium present in blood culture, in blood samples. So you collect your samples aseptically, and you just load it to this machine. And the machine has a system, inbuilt system, that monitors or measures the metabolism of any bacteria that is in the sample. And this is detected by the carbon dioxide that they produce. So on an hourly basis, the machine looks at all the bottles that are being incubated and measures the level of carbon dioxide in them. And once it reaches a determined threshold, the probe will indicate that there's a positive. So within 2 hours, if it's really a strongly positive sample, you can get your positive. And from there, from this machine, you can bring out your bottle, do a gram reaction, and if it's gram positive or gram negative, we go straight into this equipment here, which is a VTEC 2. This is also an automated system for antimicrobial susceptibility testing. So you put in this machine the same day, and you will get the susceptibility pattern, and it will tell you the minimum inhibited concentration. So this really makes things faster than manual, like I've said. And of course, we have also incubators, which are ubiquitous in any microbiology lab, any standard microbiology lab. So we have the air and also the CO2 for some fastidious organisms. And of course, microbiology is very important that you have a safe system where you can prepare your specimen without contamination. And what you see here is a class 2 biosafety cabinet, which protects both the work you are doing and also the staff that is doing the work. So everything is contained. As long as you are processing your sample inside the safety cabinet, you are not exposed to any contamination from the samples you are processing. So this is a standard microbiology lab, and I'm proud to say that this is already existing in Enugu here. So really, we're happy that we have this in place. 2 years ago, there was nothing like this, but now we have it there and it's serving the people. Some other very successful stories also. On the left, here you have what is a microbiology lab at the J.J. Dawson Hospital in a place called Harper, Maryland County, Liberia. This was between 2019 and 2022 when I was there to actually do two projects to do a microbial surveillance and stewardship program, and also laboratory quality system. And Liberia has 15 counties, which would be like our 36 states in Nigeria. And in the southeast of Liberia, there are 5 counties. And of these 5 counties, none of them have a microbiology lab. So what we did was to first refurbish a building and equipped it to standard microbiology lab. And this is the automated blood culture equipment that we are using also. And this lab really revolutionized patients' care in these 5 hospitals in that environment, because we have a transport system where we have motorbikes taking samples from the different hospitals and bring it to this central lab where it is processed, analyzed, and patients are treated. And within the first month of establishing this lab, we had a case of a woman that delivered by cesarean section, and after 4 days, he was given some antibiotics to go home. But at home, the wound got infected. And after 2 weeks, she was back to the hospital with severe pain and almost giving up. And the sample was collected, analyzed in this lab, and we found out it was a very resistant organism that only sensitive to immunopen. And at that time, that was not even in the drugs of the hospital, common drug that is used. But this was ordered. And after treatment with this immunopen for another 4 days, the patients recovered and was happy to go home with the baby and the mother. It was a big event in the hospital, and also very big news that revolutionized what we were doing there. So really, investment is worth it, but it's a lot of effort and exercise. And I'm happy that it today is running. The only challenge there was that this equipment is China-made, and there are no internal in-country staff to maintain, technicians. But we are fortunate up to now it's not it has not broken down. So really, sometimes we say Chinese products are bad, but I think they have improved over time. That is working very well, and it's much more cheaper than Bactalat or another one, which is the BD. So this is Gabon, and this was between 2010 and 2019 while I was there, but this was actually around 2012. So this is the microbiology lab at the Center for Medical Research called SAMEL in Lambaréné, Gabon. And they also have an automated blood culture system, which is called BACTEC. This BACTEC 9050 is made by BD, based in Germany, in Belgium. And for us, what we did was to have a comprehensive maintenance arrangement with them, which cost a lot. In a year, it's about $12,000. But what this means is that anytime we have a maintenance twice a year, and anytime there's a breakdown, they also have to send their technicians down. Fortunately, they have the West Africa and Central Africa office in Ghana, Accra, Ghana. So technicians do come from Ghana. But I can tell you also the challenges with some of this, because there was a time this technician came and they detected the fault, but the parts, he didn't come with the parts because he didn't know what was wrong. And he has to fly back to go and pick the part and then come back. So really, we need to build a system within our country so we to do all that we need to do. Here, there is a training going on, and these are bacterial cultures that have been identified. So many of these, to be candid, of these colleagues now are really graduates and scientists on their own. And one of my colleagues, I think, is online, is actually heading the TB lab there now. I would say that the TB lab that we started in 2012 became the TB reference lab for Gabon within the first 2 years. And last year, I was informed that they've got the ISO 15189 certification. So which means really it's a very great achievement. So this is what it can happen when you have the right people in the right place. Yeah, when we are talking of infectious diseases and in terms of pain points and also barriers and challenges and success stories, we must also talk about One Health, which is really looking at health completely in terms of the environment, the human, and the animal. And this was a publication in 2020 of a situation in a place in Uganda. You can see there's a lake, a pond, where children and adults are fetching water, bathing, and also cows are also having their time. So here there could be really infection between animal to human or human to animal. So definitely this happens in many of our remote areas or pastoral areas. So we really need to take the issue of health as in terms of One Health. And the lab, particularly microbiology lab, plays a very important role in this. The reference is given there for those who are interested. So to conclude, I want to say that despite the preponderance of pain points, these challenges that we face or barriers confronting diagnosis, particularly microbiology diagnosis in Nigeria and sub-Saharan Africa, there are many success stories of laboratories with best practices that are supporting optimal patient care. And two, that the best antidote for overcoming the pain points in microbiology diagnosis is to embrace best practices. We should promote such services and result in significant increase in clients' volume. So we can never have everything that we needed. So you may be limited by space, limited by funds, limited by workforce. But the golden rule is that in that your limitation, please maintain best practices, have the best set of trained staff that knows what to do. And once you continue to do that, you definitely make a headway because your results and your outputs, your products will speak for you. And that the obvious gaps in this field are what organizations such as Self-Focused Diagnosis Nigeria, Unimedical Healthcare, Pinecrest Healthcare Limited, and Biorad are poised to fill. So we have these headaches, we have these pain points, we have these challenges, but fortunately and happily, there are companies standing up to these needs. That's why you have companies like Health-Focused Diagnosis Nigeria, Unimedicare, Pinecrest into equipment and supplies, and Biorad, which is one of the leading ones. So from the work we have been doing with my team, this has two publications that are relevant to this. The first one is what we did in Liberia on transfer of antimicrobial stewardship, and we published this in 2022. And the second one is how we developed our capacity in the TB laboratories at Samel in Gabon, which was non-existent, but we established it, and today is ISO 15189 certified. This lab started in 2012, just 2 years after my arrival there, and then I'm happy that they've continued that capacity, and then today is a reference laboratory and also with ISO accreditation. So we can definitely make it, but we have to be consistent, we have to be committed, and we have to think outside the box on how we can provide solutions, because no one is going to do it for us. No one is going to do it we have to do it for ourselves, really. Our solutions have to be in-house built and locally built. Otherwise, we'll continue to be importing and dependent on the technology out there, providing employment for them while we are struggling with so much unemployment in our system in Nigeria and also other developing countries. So in terms of acknowledgement, first, I want to thank all of you that are listening to me, and also my numerous colleagues that I've worked with in Nigeria, in Germany, the Gambia, Gabon, and Liberia. They all have contributed to what you have listened to today. And also thanks the organizers of this webinar for inviting me. Thank you, and thank you very much. Yeah.
Wow. Wow, wow. That was such an amazing presentation. I can already see the reactions. Can you just give it up for Dr. Abraham Alabi? There was a lot to learn, a lot to learn. So when you talk about stewardship, you now know there is stewardship in the microbiology laboratory and everyone has to be held accountable. So please just keep putting your hands together, keep giving the thumbs up. I'm sure that you have learned a lot of things. Of course, he talks about the pain points, but beyond the best pain points, there are best practices that you can actually apply to make sure that on a daily basis, you're constantly improving your processes in your microbiology lab. At this point, I would want to encourage you to put your questions on the chat box. Just put your questions, any questions you have, put them in the chat box. Dr. Alabi is going to address them. So at this juncture, before I bring up the next presenter, I would love to make welcome all of Dr. Alabi's colleagues, partners that are here in this meeting. I do not know all your names, but you are most welcome. I would also want to recognize the presence of Dr. Ephraim. He's the chemical pathologist at Clinics Healthcare, Ilupeju, Lagos. I also want to specially make welcome Mr. John Ndeyok, who is the Quality Assurance Manager, Synlab Nigeria Limited. I make welcome specially Danga Tiani Joseph. He's from Gabon National Public Health Laboratory. A very big welcome to Dr. Alvin Moore. And also Mervyn Red Chester. You are all welcome. If I did not mention your name, I see you and I welcome you. You are a very special guest in this webinar. I also encourage you to sit tight. Remember, we have other presentations, but we'll try as much as possible to fit that into the time we have. So sit back and relax. Thank you once more, Dr. Alabi.
Thank you. Thank you. Thank you. Thank you. Yeah.
Yes. So we're moving on to the next presentation that we have, and that presentation is going to be taken by Mr. Shafiq Shaikji. Mr. Shafiq is the blood safety specialist at Biorad Laboratories USA. He's an experienced product specialist with a demonstrated history of working in the biotechnology industry. He's a blood safety specialist also with many years of relevant work experience. He's skilled in medical devices, blood viral disease testing, blood banking, hematology, special hematology, HPLC technology, diabetes screening, abnormal hemoglobin screening, and medical diagnostics. He's a strong sales professional and he also graduated from HPC SA. Let's make welcome Mr. Shafiq Shaikji. Mr. Shafiq, sir, the floor is yours now. Hi, Shafiq, can you hear me?
Hi, Yunus. Thank you so much. I was muted at that time. So sorry for that. But thank you so much. Really appreciate it. And what a beautiful presentation by Dr. Abraham. I'm actually glad he was before me because I've got some of the same key pain points in my presentation as well, just to confer with Dr. Abraham as well. So thank you so much. Yunus, can you still hear me?
Yes, I can hear you and I can see your screen, Shafiq.
Yeah, I just want to go to... I don't see my screen now. Sorry for that. I'm just going to try and bring it back.
Maybe you can stop sharing, then share again. Hi, Shafi, can you hear me?
Yes, Yunus, I can hear you. I'm just trying. Okay, you can still see my screen?
Yes, I can. I can see your screen.
All right, perfect. Thank you so much, and good afternoon again, everyone. So I'm going to be speaking about infectious disease testing, highlighting the testing in microbiology. So my agenda would be the microbiology workflow first. I'm going to discuss a little bit about the four pillars in infectious disease testing, a little bit on the instrumentation, some of the key pain points. I think there's about 7 key pain points with the solutions that we can offer from Biored, the references, and then a little bit of information. So before I get started, just some information on Biored as a leader in clinical diagnostics. So Biored has more than 100 years experience in clinical bacteriology, over 35 years serving the mycology and serology labs, 4 pillars delivered as one integrated portfolio, also ISO 9001 certified, 15189 and 13485 as well. So one portfolio from primary culture to confirmatory serology, our solutions in bacteriology, mycology, serology, and instrumentation for infectious disease testing. Before we get into the 4 pillars, let's quickly look at the daily workflow that we have to deal with on a daily basis. So we begin with the sample types. So either we be getting and this is the pre-analytical stage. We'll be receiving either urine samples that's used for the urinary tract infections, blood samples for the bloodstream infections, and other sterile fluids as well, with the likes of genital secretions, stools, and swabs. This will be your day 0, depending on the time the samples arrive, and also if it's a 24/7 laboratory or they only work 8 hours per day. And in most cases now we find that because of incubation periods and all that, most of the bacteriology laboratories work on a 24-hour basis. So we start with the streaking on the first day or on day 0, just depending on when the samples have arrived. Here we can offer our culture media for the streaking. At the detection stage, after the incubation, we can then offer the conventional and chromogenic media. For the rapid identification, we have the latex and immunosera. Then for confirmation in less than 30 minutes, we also have the reagents for the resistance mechanism testing. Chromogenic media that we have, the URI Select 4, the SA Select Strep B Select, and also the hemagglutination inhibition assay, which is the HIA, with the MRSA Select 2. And also we've got the VRE Select for the vancomycin resistant E identification. For the rapid bacterial identification that's done at the bench, includes our Pasterex range, which is the Pasterex Staph, Pasterex Strep, the Pasterex meningitis, and orientation test and antisera as well. Antimicrobial susceptibility test includes reference media, and we have around 100 antibiotic discs on offer, and we can also offer the beta and the carbolactate test kits as well. So with the beta lactate tests, when using this test, you can get your results under 15 minutes. And if you're using the beta carba test, you'll be able to get your results under 30 minutes. So these are for the rapid tests for antimicrobial susceptibility testing. When it comes to the mycology side, we have testing kits for the invasive fungal infections, including the likes of your Aspergillus antigens. So we have the Aspergillus antigen kit, and we also have the Platylia Aspergillus IgG kit, the Candida combined antigen antibody kits, and also we have the monofluoro kits for immunofluorescent testing in respiratory samples. Yeast and molds, including the Candy Select, Saburo Media, the Oxycolor 2, and the fungal testing determining yeast susceptibility. And this is susceptible to 6 antifungal agents. When we come to the serology part for infectious diseases, we have a broad serology menu across the patient journey that we can assist with when it comes to analysis of the diseases. So if we're looking at the prenatal and congenital, which is your torch screening, we've got the Platylia toxo kits. For the vaccine preventable diseases, we've got our Platylia measles, the IgG, IgM kits, your MMRVs, infectious mononucleus, we can offer the Platylia EBV. For the STIs, GenScreen Ultra combination of the HIV antigen antibody, which is the 4th generation kit, the Mona Lisa HBS antigen Ultra and confirmatory, Mona Lisa HCV, which is our version 2 combination of antigen and antibody Ultra kits. And then also we've got the syphilis antibody IgM, and we've also got the complete antibody test. When it comes to tropical diseases, we've got the Platylia dengue NS1 antigen and the malaria on ELISA. Blood safety and sexually transmitted infections, HIV, we've got more than 40 assays on our GenScreen Ultra HIV antigen antibody, which I said is a 4th generation kit. Hepatitis B with the Mona Lisa HBS antigen Ultra kit. For the hepatitis C, we've got the combination 4th generation antigen antibody kits. We've also got the syphilis and malaria kits as well that we can offer as solutions to our testing. Same day confirmation with Genius. So we've got the Genius confirmatory assays, which can confirm the presence of HIV and also differentiate between if it's an HIV-1 or HIV-2 infection. The Genius can also be used for confirmation for HCV as well. And one test would take approximately 30 minutes for you to get your results. When it comes to automation, we've got the Evolus family systems, which entails the Evolus Premium, the Evolus Twin Plus, both working on ELISA technology, fully automated systems. And then we've also got the manual systems where we have a washers and readers for microplates as well. So let's come to the key points in a microbiology laboratory. And we have like about 7 key points that I've listed here. And one of the things that Dr. Abrams spoke about well is staff shortages. And the reason for this is that, you know, most of the staff that have got a lot of experience and high qualified staff are always moving out of country and looking for greener pastures as well. So we also look at the turnaround times antimicrobial resistance and stewardships, invasive fungal diseases, which are missed normally by culture, retesting that we have to do, and of course, accreditation. So staff shortages is one of the highest in microbiology. We've got around about between 7 and 25% of staff shortages in microbiology. So from a biodata response, we can offer the chromogenic select media with highly contrasted single eye reading. We can offer the Pastorex latex kits needing only basic skills and equipment. And the clinical value we can get from this is that we can find a more uniform presumptive identification across all operators and shifts as well. And operational value for this pain point, shorter training curves and fewer confirmatory steps. If we look at the turnaround time, infections that require full identification, for this we have the Pastorex range, and the clinical value on the Pastorex range is targeted therapy can begin earlier. So if we detect quicker, we'll be able to put the patients on therapy earlier. Operational value for this is there is no referrals required. Antimicrobial resistance, increasing resistance across 23 million reported infections in 104 countries. So our response from BioRed, we have about 100 different antibiotic discs that we can offer. And the clinical value that you'll be able to get out of this would be early phenotypic flags, and the operational value would be compliant testing at the bench. When it comes to the healthcare associated infections that Dr. Abraham was also talking about, around 8% of healthcare workers contact infections. So for this purpose, we have the MRSA Select 2, the VRE Select, and the Pastorex Staph Plus kits. For clinical value, we'll be able to identify colonized patients and healthcare workers before actual transmission to other colleagues as well. Operational value, we have distinct colony colors that cuts down confirmatory testing and also cuts down repeat work that we normally have to do. Invasive fungal disease missed by cultures. We have the Platelia aspergillus antigen kits, and these are detecting mainly galactomannan. And then we also have the aspergillus IgG kits and the combined antigen antibody candida kits that we can offer for this pain point. Clinical value on these kits provides biomarker evidence when the culture is negative. Operational value runs manually or inside existing EIA batches, which is your ELISA batches, on the Evolus family systems, which is the fully automated ELISA instruments. Coming to pain point 6, retesting and discarding causes of false positives. For this purpose, we can offer the 4th generation antigen antibody kits for HIV and HCV. We can also offer the HBS antigen and total syphilis antibody kits. And the clinical value would be earlier detection, so you'll be able to put them on treatment faster. When it comes to operational value, these kits are high specificity and significantly reduces the retesting and blood units being discarded and also donor rejection. So in most cases, we do find that when we do have these false positive results, we do confirmatory tests. And unfortunately, we have some laboratories that don't have enough funding to buy these kits. And when they have a positive result, they actually discard the unit and they reject the donor. So the amount of donors that we have in country actually subsides because of rejecting the donors unnecessarily. As for the accreditation, standardization, and traceability, Bio-Rad has certificate of analysis for each lot, barcoded reagents, and verification panels. The clinical value would be documented, reproducible assays, and instrument performance. Under the operational value, audit-ready evidence with less manual data handling. So what we're finding is now most of the laboratories are going for accreditation for their quality control to make sure that they are doing the correct testing and giving out the correct results. So for this purpose, for accreditation purpose, also it would be advisable for most of the laboratories to start using standard operating procedures, and was also mentioned by Dr. Abram earlier on in his presentation. So why laboratories choose Bio-Rad for infectious disease testing? So like I mentioned earlier in the beginning, that we have over 100 years experience in clinical bacteriology. We have biomarkers and methods recognized in international guidelines, including the EU-CAS, CLSI as well, and the WHO, scientific content, webinars, and expert support for each technique. They also choose Bio-Rad because of confidence. High specificity reduces retesting. So a lot of retesting doesn't occur. Blood unit discard and donor rejection as well. Earlier detection with the fourth generation combo assays and a 70% shorter HCV window on our ELISA kits. Also WHO pre-qualified assays with CE mark, FDA, and multi-region registrations. So what we've noticed as well is in our market in Africa, it's quite difficult for us to start getting the FDA kits from the USA. It's a very long procedure, and also if we do manage to get these FDA kits into our countries, we do find that we have quite a short shelf life left on the kits. So it is suggested that in Africa, in our region, it's rather best for us to use the CE mark kits. Easily obtainable, and we'll have the correct shelf life, a longer shelf life as well. Also ISO 9001 manufacturing certified, batch QC, and full electronic traceability as well. Efficiency from Bio-Rad, one shared EIA protocol family across disease areas, which is run in the same batch. So we do have manual, semi-automated, and fully automated testing on the Evolus family systems. Same-day HIV and HCV confirmation using the Genius confirmatory instrument and confirmatory assays as well, including your positive and negative QCs. Verification and methodology tools that document instrument performance. So on these systems, on the automated systems, we have these additional metrology tools that we can use to make sure that the instrument is performing optimally. We also have performance evaluation kits that we can offer the laboratories to make sure that the testing is done correctly. So we're not only looking at the instrument performance, we're also looking at the performance of the kits and the assays that we are supplying to our customers. And by using these performance evaluation kits, we can see that the testing is done correctly. So most of the time we do find that in the laboratories, people move around from one lab to another lab, from one bench to another bench in the same laboratory. And we don't find the same performance all the time. So in order for us to make sure that the laboratory staff are performing correctly, they're doing the test correctly, we use these performance evaluation kits. As far as logistics goes, from a Bio-Rad point of view, our partnership with Pinecrest, we've got a lot of experience. We have set up a good communication from the time that the order comes in through to Bio-Rad, when the order gets shipped out, when it enters into the country, all the legal and regulatory documents are all correct, and we don't have any logistic problems with clearing the goods as soon as it lands in country. So references for the pain point evidence, Bio-Rad product characteristics are taken from the infectious diseases testing catalog, the bulletin PF 380, this is from June 2026, and from, you can see from point 1 up to point 14, we have all the references that was mentioned in the presentation, and also by putting together all the pain points, this is where we received all the informations from, where we put it together and created the key points. Coming to the end, for more information, I would suggest, if it's possible, if you'll be able to scan the 3D barcode, so that you'll be able to download our infectious diseases catalogs. If you can't scan, I would humbly request you to take down the web address for Bio-Rad, so that you'll be able to receive more information on our products. And also, if you have the catalogs, all our products for the complete infectious diseases testing, whether it's the bacteriology, mycology, or serology testing, is all included in our infectious diseases testing catalog. Thank you so much and appreciate it.
Thank you so much, Shafiq, for that amazing presentation. Everyone, we just heard from Mr. Shafiq Shagji. He's the Bio-Rad blood safety specialist, and he has lots of years of experience. You could hear that from his presentation. And if at this point you have interest in any of the Bio-Rad products that he has mentioned, there is a link that has been sent into the chat box. Kindly fill that out and we're going to get across to you. Okay? And if you also want us to share the IDD catalog that he has mentioned with you, also do let us know. Thank you so much, Shafiq. We're gradually getting to the end of this webinar. So at this juncture, I would want to introduce to us our panelists. We're going to be having our panel discussion right now. So I'm going to introduce you to our erudite panelists. We have Mrs. Chiamaka Nze. She's the head of the microbiology laboratory at LLab Limited. She has over 7 years of experience in medical laboratory practice. She's passionate about excellence, coordination, and quality. Her hobbies include eating and relaxation. Next up, we have Mr. Oluwatosin Ogunwola. He's the lab manager of Bolatinibu Health and Diagnostics Center here in Ikeja, Lagos. He has over 10 years of expertise in medical microbiology, and he drives standards and he sets diagnostics pace, ensuring clinical excellence. Last but not the least, we have Mrs. Favor Ofem. She's the head of the microbiology laboratory unit at SynLab Nigeria Limited. She's a highly accomplished medical laboratory scientist and laboratory leader with over a decade of extensive experience in molecular diagnostics, clinical microbiology, quality management, and laboratory transformation. Throughout her career, she has championed operational excellence, strengthened quality systems, and driven the successful implementation of several in-house molecular and microbiology diagnostic services. Mrs. Ofem currently serves as the head of the Molecular and Microbiology Department at SynLab Nigeria, where she provides strategic leadership, for one of the country's leading diagnostic laboratories. And this was seen in 2025, where she was the most outstanding lead of the year. Under her leadership, the department has consistently achieved outstanding turnaround times, maintained exceptional quality standards, delivered successful accreditation outcomes with zero non-conformances in 2025 and 2026 SANAS accreditation audits, and implemented process improvements that have enhanced efficiency, reduced costs, and improved patient care. Beyond laboratory management, she's passionate about mentorship, knowledge sharing, and capacity building. She has trained and mentored numerous laboratory professionals, inspiring excellence, professionalism, and innovation in diagnostic practice. So, ladies and gentlemen, please make welcome our distinguished panelists. Can I see the reactions again? Can I see the clapping, the thumbs up? Just to be sure that everyone can hear me. Can I be heard, please?
We are hearing you, Eunice.
Yes. Okay. Thank you very much, sir. Okay. Mrs. Chiamakanze, kindly confirm that you can hear me.
Hello, Eunice. Good afternoon. Yes, I can hear you.
Good afternoon, ma. You're welcome. Mr. Oluwatosin Ogunwola, please kindly confirm that you can hear me as well.
Hello, Eunice. Good afternoon, and thank you for having me here.
Yeah, nice having you here as well. Mrs. Favor Ofem, can you hear me, please? Kindly confirm.
Yes, thank you. Good afternoon. Yes. Good afternoon, everyone.
Good afternoon, Ma. You're highly welcome. So we have some questions that they will be answering, and these questions are relevant to the topic under discussion today. So during the course of the previous presentations, we've had our presenters talk to us about critical pain points that the microbiologist currently faces when it has to do with infectious disease diagnosis. And they have mentioned some of the ways by which these pain points can be addressed. The next question I have for our presenters is this: how can high quality products such as chromogenic media improve the reliability of infectious disease diagnosis and ultimately patient outcomes? Let's hear first from Mrs. Favor Ofem.
Good afternoon. Thank you, Eunice, for that question. Some of the benefits of chromogenic agar include presumptive organism identification with 18 to 24 hours, turnaround time. So with the help of chromogenic agar, it reduces the waiting time. You have better organism differentiation, and there's faster reporting for organisms. And because of the way the chromogenic agar works, there's reduced repeated testing. You don't have to do like a purity plate and all that. There's also consistent performance. So that is how some chromogenic agar can help improve reliability of infectious disease and patient outcomes.
Thank you so much for that wonderful response. I would move on to Mr. Oluwatosin Ogunwola. So your question is this: so despite advances in diagnostic technologies, what are the biggest barriers preventing healthcare facilities from adopting modern microbiology testing solutions, and what practical strategies can overcome these obstacles?
All right, thank you very much, Eunice. Good afternoon, everybody, and
Good
I'm
afternoon.
once again happy to be on this call today. One of the challenges that we face as medical microbiologists, especially in terms of establishment, is the cost of establishment. which is usually the capital expenditure capex and the operational expenditure. As Dr. Alabi was speaking earlier on, he mentioned the fact that some of these modern technologies are quite expensive, and many laboratories might not be able to afford them. Nevertheless, practical steps to take to get some of these things include rental services and placement arrangement. We have, and that's why we need organizations like Pinecrest here, who are doing a great job in terms of equipment placement and in terms of rental services. Another thing that we need to look at is that you don't, as a laboratory, you do not have to do everything. One of the things that we can do as laboratories is strategic partnership and collaboration. If you know that your laboratory is not having that capability yet, there's nothing wrong in partnership. There are labs around in town that we can partner with effectively, and then they can run such labs for us. It's better to have a little bit delay in giving out a good result than giving out a bad result early. So partnership, strategic partnership is very important, and then partnership with organizations like Pinecrest in terms of equipment placement and rental services is also one of the methods that we can look into in establishing our diagnostic services and ensuring that we are able to meet up with standards and requirements of the society. Thank you, Ollie.
Thank you very much, sir. There was something very important he said that I picked out. He said, it's better to have a good result than to have a bad result early. So that is very important, and that is a very big take home for me today. I'm going to still ask Mrs. Favor another question, and the question is this. Ma, with the growing threat of antimicrobial resistance, what role should microbiology laboratories play in strengthening AMR surveillance? Let me just, because of that interception, let me just take the question again. With the growing threat of antimicrobial resistance, what role should microbiology laboratories play in strengthening the AMR surveillance, antimicrobial stewardship, and evidence-based clinical decision making? Did you get my question, ma'am? Hello, Mrs. Favor, can you hear me?
Identify organisms. We need to have reliable susceptibility testing, and we need to have compliance with the Clinical Laboratory and Standards Institute. We also need to monitor resistance trends and then share data amongst microbiology labs monthly or annually to be able to check some of these trends. We also need to discourage the unnecessary use of antibiotics, especially before sample collection, because once there's already antibiotics being taken before collection of samples, the diagnosis will already be wrong. We also need to guide the selection of antibiotics, work with clinicians and pharmacists to support infection and prevention control. So if we are able to detect resistant organisms, we would be able to support any outbreak investigation. So those are some of the things we need to look out for. So in summary, rapid reporting, data-driven clinical decisions, quality when it comes to AST, and then continuous staff improvement.
Wow, thank you so much. I'm learning a lot and I'm taking notes. I hope that the other participants are also doing the same so that whenever there is an outbreak, we can be better prepared to give the needed support. Thank you so much, Mrs. Favor. My next question goes to Mrs. Chiamaka Nse. And I'm asking you this question because I want to hear from your own point of view. How can high quality products such as chromogenic media improve reliability of infectious disease diagnosis and ultimately improve patient outcomes?
Okay. Hi, Eunice. I hope you can hear me, first of all.
Yes, I can hear you. Please go ahead.
Okay. All right, all right. Firstly, I just want to say thank you to Dr. Alabi for the vast knowledge sharing he gave this afternoon. I was really, really wowed with the presentation, with the speaking. So on behalf of LLab, this is me saying thank you, and thank you to Pinecrest for giving us this opportunity to talk on this topic. So to your question, you said, how can high quality products like chromogenic agar improve reliability of infectious disease diagnosis, right? So first of all, we've established that chromogenic agar is a high quality product. And for me, I know that this media helps clean us in the lab, the laboratory personnel, make good, precise pathogen identification. It also helps clinicians make timely treatment decisions, right, to improve patient outcomes and strengthen, the use of antimicrobial, substances. Yes. So I know the chromogenic agar is a kind of media that produces enzyme substrates to help bring out distinct colony colors, for different microorganisms. So what it can do is to help initiate fast targeted antimicrobial therapy. It can also improve clinical outcomes, especially in critically ill patients. So faster turnaround time is a win-win for both the laboratory personnel and the clinician who is requesting for it. And also the laboratory personnel who is working with such agar also has a better recognition for polymicrobial infections, like when you have more than one growth, on an agar. With the color differentiations, it can also help to differentiate what is there and what is not, right? And it can also reduce risk of overlooking clinically significant pathogens. Yes, and another benefit it has is, like I said, greater diagnostic accuracy, fewer identification errors, and also better confidence in laboratory results. Yes, thank you.
Thank you so much, Ma. That was really insightful. We are gradually coasting home, but I would also love to hear Mr. Tosin's own point of view concerning how chromogenic media can improve the reliability of infectious disease diagnosis and ultimately patient outcomes.
All right. Thank you very much. Just as the other speakers have spoken well, Mrs. Favor of Firm and Mrs. Chama, they've all spoken well, talking about TAT and the need to and the ease of identifying multi-infections where you have multibacterial infections and measles. Aside from that, chromogenic media, people see them as being expensive, but in reality, the benefit of having them far outweighs the cost. For instance, um, for us to effectively and correctly identify an organism using the conventional method, look at the processes that you have to go through. For instance, you want to distinguish from E. coli and let's say Klebsiella. Let's say you use colonies, you need to identify them whether they are it's actually E. coli or another organism. You need to start doing the gram, you need to do the indole, you need to do the oxidase, iodurase, the citrate, and then when you put the cost of these reagents together, the cost of Simon citrate, the cost of urase, the cost of indole reagents, when you need to do oxidase. When you put the cost together, you see that it almost equals the cost of getting a chromogenic media. And this cumulative data gives you your results from the first glance. It gives you a preliminary result, it gives you a presumptive ID, and then you are able to tell the clinician. I personally work in a tertiary institution, like development tertiary institution, and then clinicians are always asking for preliminary results so that they can commence treatment or change the course of antibiotics and therapy. And that's where community media comes in. It gives a preliminary result, a preliminary ID that clinicians and doctors can quickly use to to um to initiate treatment and then change the course of treatment as the case may be. The chromogenic media also helps with the reduced turnaround time. You are able, like I said, you are able to give out you got a presumptive identification in minutes, in hours, and then your result is ready. And then media like the VRE select media that Mr. Shafiq put earlier on, it helps you to be able to identify different strains of organisms. You can have your streptococcus organisms. You can be able to identify them quickly and almost immediately. Imagine having to set up other forms of identification to differentiate enterococcus from streptococcus. You start looking for bile esculins, you start doing NaCl, you start doing those other tests. So those things are time consuming, and that is where homogenic media comes in to give you a preliminary ID that you can work with within the shortest time possible. Thank you.
Thank you so much. Thank you so much for that response, Mr. Tosin. So at this point, we're going to be taking the last question, and I'll need all the panelists to respond. So let's start with Mrs. Favor Fem. The last question is this. Looking ahead, what innovations, partnerships, and best practices have you adopted in your facility to transform infectious disease testing? Something that another scientist can learn from and go home with. Thank you, ma'am. Over to you.
Okay, thank you, Eunice, once again. So some of the innovations we're able to adopt to transform infectious disease. So we expanded beyond the COVID, we expanded the molecular lab to have arrays of tests for PCR. So not just viral load, we have STI testing, multiplex system as well. We also had digitalization of our electronic reporting. So we don't have to, clinicians don't have to reach out to us to say, okay, I need my result. We already have a result delivery system where you're seeing your results live as it's, being entered on the LIS. We're also able to, incorporate periodic competency testing. So it's not enough to train personnel. You have to periodically deem them competent. Okay, this training that, they were able to undertake, are they still competent? Currently, we are accredited under the ISO 15189, and we know it entails regular assays of QCs, participation in proficiency testing. So those are some of the innovations we've put in place to actually, transform infectious disease diagnostics. Now, about partnerships, we'll be able to partner with not just clinicians, but manufacturers, academic institutions. We have not just students, other research partners coming to partner with us as well. We also have PPPs rather, and government agencies that we work with because we cannot do this on our own. We have to come together because microbiology is not just a testing center, it's a critical partner in clinical decision making. So we need a lot of collaboration with everybody to be able to, transform infectious disease diagnostics. Thank you.
Thank you so much, ma'am. So over to you, Mrs. Chiamaka Nze. So what innovations, partnerships, and best practices have you adopted in your facility to transform infectious diseases diagnostics?
Okay. All right. So with the chromogenic agar, we have been able to enhance rapid detection, right? And differentiation of clinically significant pathogens. We've also adopted the use of automated methods of identification and AST platforms to also help improve our accuracy and equally reduce turnaround time, because at the end of the day, we all know that CAT is quite important in the treatment, in diagnosis of clients, of patients, so to speak. And we also have a platform, where we also review lab workflows, like personnel, like what my colleague Mrs. Favor said about the competency assessments done. We also carry out competency assessments to ensure that the personnel working are still up to that level we need them to be to ensure accuracy, and reliability of results. And of course, we are also an ISO certified laboratory. Yes, so everything quality management practices is a must for us here in the facility. And for partnerships, we have collaborations with government. We also engage in EQAs, external quality assessments, to benchmark lab performance and also help to drive continuous improvement. And for best practices, like I said, we also, I mentioned the competency assessments, professional development for lab personnel. We ensure timely communication of multi-drug resistant organisms, and we do this to help support clinical intervention, and infection prevention measures, right? And we emphasize on proper specimen collection, transportation, and processing, so that we can have exactly what we are seeing or what we are analyzing is actually what it is. Yes, that is it. Thank you.
Thank you so much. Thank you so much for that very succinct feedback or response from you. Finally, we move on to Mr. Tosin. Sir, kindly share with us the innovations, partnerships, and best practices you have adopted in your facility to transform infectious diseases testing.
All right. Thank you very much. In addition to what every other person has said, one of the things that we do, which is very critical to us, is continuous development programs, CPDs, ensuring that we go beyond just recruiting capable hands. We ensure that they get better on the job. Okay, so we ensure that there's training and retraining of medical laboratory scientists and staff that are working in the lab. One of the things that we also do to ensure best practices is to enroll in external quality assessment programs. You can just be in your facility and assume you are there. You just be a local champion, believing that you are doing all that you are need to do. But when you are compared with global brands, with international laboratories, you begin to assess yourself properly, and then you know that indeed you're actually doing well. And then if there are loopholes, there are things I need to correct. You also do that as well. Another thing that we did was to is that we currently have a laboratory management system, LIMS, which also sends and transmits results to clinicians and even our clients via SMS and email. So as soon as the result is ready, you get a report sent to your phone via SMS via a link, and then you get your results immediately. Another thing that we did is ensure automation in our microbiology laboratory. Most laboratories in Nigeria, especially microbiology, is the last of the units to get automated. And it's everywhere, even in government owned hospitals. Microbiology usually is the last to get automation. Most facilities are still using manual methods of identification for blood culture and the like. So we have initiated automation, and then it's probably doing the job for us, and it's working. Yeah, initially while training, we should be afraid of automation. We should believe that automation will replace scientists, but no, that's not true. Automation is there to help scientists and to make us do better. So I want to implore other laboratories to also uh, uh, take on automation. Another thing that has really helped us is partnership with locally based vendors, such as Pinecrest, who also supply the equipment, as well as they provide services that we need, especially in terms of management and maintenance of our equipment. Imagine having an equipment where the OEM is one for the entire country, and your OEM is in Sokoto, for instance, you're in Lagos, and he's partnering with an equipment there. You have to wait till it's done before you can move on. Now imagine if you don't have a backup. So it's always good to have locally based vendors who have service engineers and vendors who can quickly come to facility to 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 help you and help you resolve your issues so that you can also work. Another thing that we have done is to implement the aware um aware stewardship program where we ensure that um antibiotics that are maybe the last resort or powerful antibiotics are not released to the doctor so that we do not add to the already existing AMR that is plaguing the entire world. So this, in addition to everything that other person has said, are some of the processes that we have put in place to ensure standard practices and ensure that our facility is doing what needs to be done. Thank you very much.
Thank you so much, Mr. Tosin. I've actually learned a lot from all the panelists. I'm going to give us a summary, but at this point, I would just want to hear the final notes from each of the panelists. Mrs. Favor, can we get the final notes from you for this session? Hello, Mom. Can you hear me? Any final notes from you?
Can you hear me now?
Yes, I can hear you now.
Okay, so I would like to say that the right specimen is the foundation for the very right diagnosis. And then once we have faster diagnosis, it means earlier targeted treatment and better patient outcomes. So for us, automation should not should not replace our laboratory professionals, but should complement them. So the question we should ask ourselves, at the end of this webinar is, what practical steps can we take today to reduce unnecessary antibiotic use? How can we better improve diagnosis? And how are we investing enough in ensuring that patient outcomes and therapy is, at the highest standard? In all, I would say that the antibiogram tells us the story of the antimicrobial resistance. So we should not just look at ourselves as competitors. We should try and see how we can collaborate, because in the end, once a patient is better, everybody would, be happy. Thank you.
Thank you so much, Mrs. Favor. Let's hear the final notes from Mr. Tosin Ogunwola.
All right. Thank you very much. Earlier on when I was speaking, I said that it's not a must for your laboratory to do everything. Know your strengths and improve and develop as you go on. So strategic partnership is very important, as Mrs. Favor has also reiterated that we can always partner with one another to ensure quality diagnosis, which ultimately is what the clinicians and even the patients are looking for. So we should partner with ourselves. Another thing that we should also work on is working with our data. Many but if you ask yourself, for instance, now your data for 2023, 2024, where are they? They are lying down somewhere, and that's where they might be. In 2 years' time, you archive them, and after that, you destroy data. It's gone. And this is what developed countries work with. You see papers that are released yearly, giving data. It's based on results that are generated in the lab. So as medical laboratory scientists, as policy makers on this call, can also collaborate and work with data and then have data backed procedures, data backed surveys that we can say yes, as far as Lagos State is concerned, as far as Nigeria is concerned, this data is accurate. So we need to also partner in terms of publishing data and ensuring that the data that is out there tells the story as it is. And then um, we should ensure that we do all that we need to do to ensure that the patient goes home happier than they came to our facilities. Thank you.
Wow. Thank you so much, Mr. Tosin. We have to have data and our data should back up the procedures. Thank you so much. Let's hear the final notes from Mrs. Chiamaka.
Okay. Supporting what my other colleagues have said, especially Mr. Tosin, I would say we should really foster partnerships, right, with laboratories that can be able to run, analyze some assays that another, laboratory is not able to. So we should not do the approach of I can do all things by myself. No man is an island, right? So it's important to foster multidisciplinary collaboration, among lab professionals, clinicians, pharmacists, infection prevention teams, and also public health authorities. I emphasize mainly on collaborations, and partnerships. If we do this together, I think we would help curb this whole issue of infectious diseases attacking one particular area and not on the other side. And also by combining high quality, diagnostics, strong quality systems like the LIS, and also quality procedures, continuous workforce development, microbiology labs can actually move beyond just generating test results, to becoming essential partners in clinical decision making. Antimicrobial stewardship, like Dr. Alabi mentioned, disease surveillance, and also improve patient outcomes. I feel this approach will actually be very important in addressing emerging infectious diseases and growing challenge of antimicrobial resistance. Yes, thank you.
Thank you so much for that response. So at this juncture, we have come to the end of the panel discussion session. And some of the take-homes we have from this session include enrolling for an external quality assessment program, ensuring that you improve your turnaround time, the importance of working with data so that the data you have generated begins to influence your decisions in the light that it will lead to improvement in your practices. And then whether your processes are manual or automated, ensure that you are following best practices. And like I had announced earlier, if you're interested in the chromogenic media or any of the products from the BioRad portfolio, do let us know. And also for external quality assurance, also known as proficiency testing, we have 17 fully accredited programs. The serology programs are also part of them, where we have the HIV, hepatitis, syphilis, Chagas, and the rest of the other programs, such as the chemistry, hematology, immunoassay, blood typing, and so on and so forth. So I am handing over the mic to Dr. Chijioke Onya to give us his closing remarks. Dr. Chijioke Onya. Oh, sorry about that. I missed out.
Yeah, I think
I
that's
missed out the
the
questions
question.
and yes, sorry about that. I missed out the question and answer sessions. Samson, Mr. Samson Chukuma, Field Application Executive, Pinecrest Healthcare Limited. Please kindly confirm that we have questions in the chat box. In the absence of questions, we'll go ahead with the closing remarks. But if there are questions, please bring them on. Thank you very much, Mr. Samson. Over to you.
Okay, thank you very much, Ms. Eunice, for anchoring this webinar. So from the chat box, I think I have one question. One of the that it should be two questions, but one is just like a suggestion, and the other one is a question going to Shafiq. So from what I have here, so the suggestion that Mr. Arnold made, he said, "Hi everyone, congratulations to Dr. Alabi for this excellent presentation. How to strengthen our labs in low and middle income countries in terms of quality, knowing that it is difficult, for instance, to get a reference strain like American type culture collections to be confident with the result we are generating. due to high cost. And they also put forward that it is difficult to have a really modern labs with all the equipment you showed in your presentation. The idea may be to start by having a reference lab with high standard facility and expertise to help small lab to improve, just like a suggestion. So the other question, the question I have here is from the person's, the vice was not named, but HP, but the question was directed to Shafiq. He said, despite effort made so far reducing antimicrobial resistance, little has been achieved. How do we improve on this through networking? So I don't know, Shafi, can you hear me?
Sorry, Shafiq has had to join another meeting. So, Dr. Alabi can go ahead and answer both questions.
Okay, okay, Dr. Alabi, can you hear me, sir?
Yes, I can hear you clearly.
Okay, so the question said that despite the effort made so far reducing antimicrobial resistance, little has been achieved. How do we improve on this through networking? Thank you, sir.
Thank you very much. And I think one of the ways to improve is what we are doing now, really. Awareness is very key, particularly also each of us represents a family. I mean, you and I were from individual families. We belong to groups because what are the drivers of this resistance? A country like Nigeria is one that if anybody feels sick, the first thing, they don't go to the hospital. Let's be honest with ourselves. The other try to self-meditate, which means they can use some agbo or some preparation. If it's not going, they can go to a chemist. And it will be when this is not possible that they go finally to hospital. So awareness is very key. Also in terms of regulation, I think Nigeria is trying this aspect, but we still can do more. I don't know, but in Liberia, for instance, by the time I left there, they were still allowing vendors to be selling antibiotics in the markets everywhere. So the laws are there, but the control is very weak. So this is one thing we can also do. And some practices, people go to hospital, they collect antibiotics and they don't finish it. They either keep it for the next time the infection comes back or maybe to a neighbor. All these practices, I think we can do a lot through groups we belong to, through the show, to let everybody be aware. Because it's a reality that this is a problem facing us, and if care is not taken, if not effort is not made, by 2050, it's said that there will be about 10 million individuals dying from resistance, difficult to treat infections. And in the US alone, they did a study in 2022. For just US alone, they lost about $6 billion to this kind of infection. So it's a menace we have to deal with. I will not completely agree that nothing is being done. No, a lot of things being done because most African countries, including Nigeria, they have a national action programs against antimicrobial resistance. And in Nigeria, it's very strong. As a matter of fact, there was supposed to be a high-level meeting of ministers in Nigeria in June this year. It was held in Saudi Arabia last year and was supposed to be hosted by Nigeria this year. Because of the crisis there, this has been postponed now. I don't know the new date, maybe in August or sometime. So a lot of effort being done. There's a secretariat in the Federal Ministry of Health and with representatives from all the 36 states, from our institutions. So a lot is being done. Everybody is aware. But what we need to do is to regulate first the quality of these drugs and also to allow to have a way that you don't take it when you don't need it and you don't self-meditate. So a lot is being done. And another question that was asked is the question of small laboratories not being able to do not be able to go maximum. I can tell you, Air Focus Diagnostics Nigeria is a private business. Truly, the initial investment is very costly and very high for obvious reasons because we started with automation right away. But I can tell you that First, we have talked about collaboration here. If there are tests you cannot do in your lab, you can collaborate with other labs to do this rather than cutting corners. What I've seen, there was a time we were looking for antibiotics to buy, and they brought us one that was manufactured somewhere in Nigeria. Really, this was really very, very bad because it was just filter paper that somebody devised, which initially is good, but you shouldn't be selling that. Somebody devised and then put antibiotics on each of the small discs, and it's being sold to labs, and some labs are buying and using. The potency is so low. So this is what we need to avoid. First, to really best practices. If you don't have capacity of doing something very well, there's no point doing it because you're actually compounding the problem, like rather than solving it. And with organizations like HFDN and all these people around, I think we are moving in the right direction. And Nigeria, we can be hopeful that this is going to go in a positive way. But a lot depends on us, practitioners, and also talking to our people in our churches and mosques, group, WhatsApp groups, that to let people be enlightened that if you don't need to take an antibiotics, you shouldn't do it, and not to self-meditate. If you need to go to the hospital, go to the hospital. For instance, we are having fever. You don't know, it may be a bacterium, maybe a virus, maybe a parasite. So why self-meditate? You need to seek diagnosis first, and then treatment will be very specific and effective. Thank you very much.
Thank you very much, Dr. Abraham, for that wonderful insight on the question that was thrown down to you, sir. So I hope the question had been addressed, sir. So in absence of other questions, over to you, Miss Eunice. Thank you very much. Thank you.
Thank you so much, Mr. Samson Chukuma, for handling that session. And thank you so much, Dr. Alabi, for being with us up to this moment and for answering that question. So at this moment, I would love to make welcome our Managing Director, Dr. Chijioke Onya, to please give us the closing remarks. Dr. Chijioke, sir, over to you.
Thank you so much, Eunice, for the fantastic job you've done as our counsel and for all you do for our healthcare system. I'm not here to give a vote of thanks, so I will give the vote of thanks to the person that has been directed to handle and to give. I want to state clearly that when we started this program or this webinar, our intention was to sow a seed. And I want to clearly say that by the grace of God, the seed has been sown and sown adequately well. The speakers have been awesome. Our panelists have been very, very, very articulate in the response to their answers. They have shown the professionalism and also the expertise that we had anticipated are going to display when we selected them among the crop of other scientists to handle the panel section. I want to really express our appreciation. And I want to say a whole lot has been said. The seed has been sown. And like a seed that is sown, we expect that this seed is going to germinate, is going to metamorphose into a very big tree. And under the shade that will be provided by this tree, we hope that the pain points that are associated with infectious disease testing in Nigeria, we are going to start addressing them. I want to sincerely say that if you forget everything that I've said today, don't forget the fact that with Bio-Rad chromogenic agar, you can actually reduce the turnaround time for the results of your infectious disease testing from 3 days in some instances to a few hours. This is massive in terms of its contribution to antibacterial treatment in our country. Because what you see going on is that when patients are suspected of having bacterial infection, there's a little bit of an empirical commencement of treatment, which in some instances may not be the right treatment that should have been commenced when the final result is out. And all this trial and error approach to antibacterial management contributes to fueling the antimicrobial resistance that we are facing today. So a part of what you can achieve, cost of this webinar, is that we go into the usage of chromogenic agar from Bio-Rad to reduce the turnaround time of antibacterial identification and also enhance proper treatment and proper management would have contributed significantly to taming the tide of antimicrobial resistance. Also, imagine the fact from what Dr. Alabi just said. I remember when I was in the industry marketing antibiotics, We know there are instances where people play some bit of gimmicks in terms of bringing antibiotic sensitivities that have not gone through the proper validation using based on going through the certifications that are required to ensure that the antibiotic sensitivities are bringing into the market are properly produced in line with standards. And this has been causing a whole lot of problems in terms of proper identification and also in terms of proper treatment and management of antibiotics, bacterial infections. Sorry. But again, from the stable of Biorad, you are sure of getting very well prepared antibiotic sensitivity discs that meet the global standards and are properly handled, that will give you the exact result you need based on the expectations according to the guidelines. That's also another very big thing that we're putting on the table. And that's one of the measures we are going to use in removing these pain points. So in summary, ladies and gentlemen, I want to call upon us to join hands with Biorad and Pinecrest as we move towards addressing these identified pain points, because ultimately our health systems and our teeming patients will be better for it. On that note, I want to thank you very much for your attention and also for participating in this particular webinar. Over to you, Eunice. Thank you very much.
Thank you very much, Dr. Chijioke Onya. So on that note, I would love to give the vote of thanks on behalf of Pinecrest Healthcare Limited. I love to specially thank the management and the staff of Pinecrest Healthcare Limited for actually putting this up and for giving us the opportunity to have this program, because if management said no, there's no way we would have had this program. And on that note, I would love to specially thank our Managing Director, Dr. Chijioke Onya, for being the wind beneath our wings. I also want to expressly thank all my team members who are also here on the call. I have Miss Lucy Dansofo. She is the Pinecrest Field Application Executive here in Lagos. We also have Mr. Samson Chukuma. He's also a Field Application Executive here in Lagos. We have Miss Augusta Obieshi. She is the Field Application Executive handling the South-South and the Southeast. And we also have Mr. Gospa Owadike, Field Application Executive handling the North. Right here on this call, we also have Mr. Emmanuel Ebem. He's the Business Unit Manager for the Rapid Check Strategic Business Unit for Pinecrest Healthcare Limited. Thank you very much, sir, for coming. I want to specially thank our keynote speaker, Dr. Alabi, for this outstanding, amazing presentation. People are already asking us for the recording, and we're going to send that across to all the participants that we have their details. I also want to specially thank Mr. Stanley Obonna for being a very strong support for us here at Pinecrest Healthcare Limited. He is the General Manager of the Health Focus Diagnostics Nigeria Limited, Enugu. I want to specially say thank you to all the pathologists who are here with us today. We have Dr. Ephraim from Clinics Healthcare, as well as other pathologists that are here with us. Thank you so much to all the medical lab scientists who are here present, and to all the microbiologists. Thank you so much for coming. Very, very special and big thank you to all our panelists. So on the panel session, we had Mr. Oluwatosin Ogunwola from Bola Tinubu Health and Diagnostics Center. We had Mrs. Chiamaka Nze from L Lab Limited, and we had Mrs. Favor Ofem from Synlab Nigeria Limited. And on a very special note, I love to thank all the organizations that they represent for letting them do this with us, for letting them share their best practices and their experiences. I also know that here in this room, we have all the representatives from the different laboratories and hospitals all across Nigeria. I can see people from Far North, Kano. I saw Malam Kabe. I saw people from far south, southeast, southwest. Thank you so much for being on this call. And up to this time, we have over 70 participants, even though we have we have shot past our time. So thank you so much to everyone. You are valued and we are glad you could make it. So be on the lookout. We have programs filed up for you, programs that are very enriching that you'll learn from all through the year. In the course of this quarter, we are going to be having our case review of cases from the HPLC system. We are going to be doing that in collaboration with SciLab. So be on the lookout for the flyer and come and learn something new. And by the next quarter, we are also going to be having a quality assurance webinar like we do on a quarterly basis. Also come and learn. If you need to contact us, our phone numbers are there on the chat box. So on this note, thank you. I think Dr. Alabi wants to say his final thank you. Mrs. Yes, yes. So go ahead, sir.
Okay, Eunice, thank you very, very much, really, because I must say that really, Pine Quest and Rubaura, you are wonderful, and you have handled this very well. It may surprise many people that really we never met before, really. Stanley just mentioned to me, and I said, no, if this is for the good of our people, why not? So, and the coordination was very good. We talk almost every day as the thing was getting nearer. So all the support that I needed, I got, really. And this is very good, to be candid. We are talking of AMR. I think it's a very good one that we are doing. So also, if it's possible in the near future, I think you could also organize one like this, and we can get people to key into that, to any aspect. So anytime you are ready, we definitely support, really. Good to share experiences. Just to say again that from where we started from, a lot depends on us individually and then collectively. So wherever we are operating, please put in your best, because we are all really serving mankind. And the best area, one of the best area you can be is clinical services, or diagnostic and clinical services. That you see someone with an issue and then you're able to resolve it. I think money cannot even buy that, really. So we are really doing excellently well, and I'm grateful for your company for finding time to sponsor something like this, really. And we just need to collaborate. So thank you very much. And we look forward to the future. And for you especially, thanks for the excellent collaboration and the cooperation and supervision and coordination. All the best, really. Thank you.
Thank you so much, sir. Thank you, everyone. It was nice having you on this call. Our phone numbers are on the chat box in case you need to contact us. Thank you so much, everyone.
And MD, thank you very much. Dr. Shijoki, thank you very, very much.
Thank you so much, everybody. Thank you so much, Eunice. Thank you for all the coordination. And we have a great day and a great week.
Bye.
Bye-bye.
Bye, everyone.
Bye, bye, bye.
Bye, everyone.